guys, it's Lex and welcome back to our channel. Tat's not here with us today, but it is okay because we are going to be getting into the BBL process. So let's get into it. So I started the process roughly around 6 months ago. I was still living in Philadelphia, so I decided to go with a surgeon that was close by. I went to a surgery center that was also in Philly, Dr. Goodbye. He works magic, guys. But the whole process was, all in all, pretty easygoing, and I would definitely recommend it to anybody who is looking to just feel even better about themselves on the outside and in. So I started the process with going to a consultation. I basically met up with the doctor. We spoke about where exactly I wanted to take fat from and where I wanted to put it and how. So the first initial meetup with the doctor was relatively simple. I thought that he was pretty easygoing. He had been doing this for quite a while, and he definitely answered any questions that I had about the process and also about what to expect. So that's pretty much what you can expect at the consultation. It's probably about a 15-minute meeting between you and the doctor where you discuss exactly what's going to happen during the BBL and what pre-op and post-op would look like. So fast forward to pre-op day, which is the day where you basically meet up again with your doctor and you tell him about what you want your body to look like. You can bring pictures if you'd like, diagrams, anything that basically helps you depict the body that you vision for yourself. Dr. Goodbye was really helpful, and he also gave me some recommendations in terms of the silhouette of my body and where he would put fat and take fat from. So I really appreciated doing the pre-op, and it also gave me an idea of what I would need for the operation day as well as what I would need for my post-op. So for my pre-op, I got a list, and I also have been doing a lot of research about exactly what to take with you and what you don't need. And I'm going to give you guys the 411 on what you really need for your BBL surgery and post-op and what's really not necessary. So you're definitely going to need to start taking your vitamins. They recommend that you take a multivitamin, an iron pill, and vitamin C. So you're going to start taking those vitamins roughly around 2 to 3 weeks before your operation day. You're also going to want to start getting your body hydrated. This is definitely a process in which the more hydrated you are, the easier it's going to be for your body to heal. So along with the vitamins, you definitely want to stay hydrated. Now there's a couple other things you might want to pack and some things that you really can leave off until you're back home. So one thing that I definitely found important but not extremely useful from the beginning is the bobby pillow. You're not going to even want to sit on your butt at all, really. So it's really not necessary unless you're traveling and you need to actually sit down, because besides that, there's going to be no real reason for you to have the bobby pillow until about week 2 or 3. I'm currently a little bit after 2 weeks, and I'm just really starting to even sit on my butt a little bit, which is why I say you can hold off on the bobby pillow if you'd like. Something I would suggest definitely getting would be the arnica gel or the tablets. I read a lot about how they help with the swelling and bruising, and it really does help, especially when you're first coming home and you see all that swelling and purple and blue. The arnica gel definitely helps. So I would say to pack that along with plenty of water and Powerade and puppy pads. Those are literally the things that I would say you really need to have. I didn't get a massage, but I did look at videos with my partner. She's been very helpful about massaging me every couple days and just making sure that all my blood is flowing correctly in the areas where the fat was taken out of, and massaging around the drainage areas. So now we're pretty much getting into operation day and post-op. So for operation day, you want to dress in something comfortable. Usually it's early in the morning, so no makeup, no moisturizers, and you can't eat at least 24 hours beforehand. Literally, or you will have complications during your process, and you don't want to do anything to mess up the process of you having your new butt. So operation day came, and I was super nervous, definitely about going under, but it really wasn't that bad. after I went into the dressing room, they gave me a pregnancy test for whatever reason. Well, I know why, but I know I'm not pregnant. Nevertheless, they give you a pregnancy test and they give you your IV. And honestly, by the time you lay on the operation table, you're asleep. I woke up what felt like 10 minutes later, and I was already in the recovery center. I didn't even feel anything at all. My girlfriend came to pick me up probably about 20 minutes later, and I had to lay in the back seat of the rent-a-car. That's pretty much how I got home. You're not going to want to lay on your butt. You're not going to want to sit on your butt. So any other way, whether you're sitting on your knees or you're laying down in the back of the car, is pretty much the only way that you're going to travel, especially within the first week. Post-op, the pain. Everyone talks about the pain differently, and I know pain is different for everybody, but for me, if I could explain it, I would say it feels like you've worked out all day, or you've been carrying boxes all day, or you really had like a full body workout, basically. Like your back is sore, your legs are sore, but it wasn't painful. And definitely the medication that they give you makes it even less so. But you definitely want to make sure that you're comfortable as possible. Like I said, you do not want to sleep on your butt at all. So if you're a back sleeper like I am, get over it, sis, because it's not even going to really feel comfortable. You are going to have a lot of leakage, so definitely bring as many puppy pads and old bed linens that you can. You're also not going to be able to sit on the toilet at all, so squat game needs to be correct. You have to have the meg legs, or you can use a urinal. And they have these cool little female funnel urinals that are pretty cool. I do have one, but I haven't used it, and I don't really need it. So it's not a must-have, but it's something you can use. They do give you pain medication, but I would also suggest to bring some Tylenol because they don't give you that much. You're still going to be feeling a little bit sore for the next couple weeks. And also just, again, stay hydrated. Make sure that you're drinking plenty of water because, again, you're going to be trying to get all of those fluids drained out through all the incisions. And the more water you drink, the easier it'll be for it to pass. So right now I'm a little bit post to operation by about 2 weeks or so. And I am seeing changes in my body every day. I will also suggest that you do not take off your faja more than necessary. I know it's hard. You want to be cute, you want to show off your shape, but you also don't want to faint. So take your faja off for about an hour or so a day when you're showering and you want to clean up or anything or wipe do laundry. But then after that, then put that sucker back on. Suck it in, leave it out. Definitely wear your faja because, again, you don't want to experience any type of fainting or fatigue or inflammation because your body is not being compressed and contoured in the right areas. So I also noticed now that it's been post 2 weeks or so that my faja is starting to get a little bit looser. I have my level 2 faja coming, stage 2 faja coming pretty soon, which is supposed to, keep you just as compressed. But now that your body is, the swelling is going down, you're going to need something that's a little bit smaller. So I'm on my way towards my stage 2 faja. Just waiting for it to come in the mail. Like I said, the stage 1, you're definitely going to need for the first 2 to 3 weeks or so. But like literally at this point, I can grab at my faja in places I couldn't. Definitely excited about, continuing the process. I am going to give you guys an idea of what it looks like 2 weeks post-op. Again, when I did my surgery, I explained that I wanted something as realistic as possible. And I really just wanted a nice shape and a nice silhouette. So I'm going to change to something a little bit more comfortable so you guys can get an idea of what your body's going to look like front and center. So this will be my first time actually putting on something other than sweatpants. Because that's literally all you're really going to want to be in anyway for the first couple weeks. So I'm excited to see too what it's looking like. Let's see. So as you can see here, this is my first time actually putting on a dress that I already had in a size small. And so far the bruising has gone down a little bit. I did get my bat wings taken care of, so it's still a little purple in my arms. They took from under my boob area a little bit. and also from my belly and my waist area, I guess above my waist area. And stuck it right there, stuck it right in my bottom. So this is really what it's looking like 2 weeks post-op. Like I said, it's as realistic as I think I could get. I really didn't want to look too wonky in terms of my measurements. So I'm pretty excited about the results, and I'm also excited to see what it will look like in a couple weeks. So stay tuned so we can figure it out together. Alright guys, so I just want to give you guys a feel for what to expect in terms of your body and what's it going to look like 2 weeks after surgery. The swelling is going to be going down. The bruising is going to be going down slowly, especially if you're using gel or anything to help expedite the process. You're definitely going to feel a little bit tight in your belly because like they literally sucked out everything. But so far so good. So if you found this video useful and you want to stay tuned for more videos about my follow-up and my BBL process, don't forget to like, comment, share, and most importantly, subscribe. Peace.